Every man thinks he knows what positions women prefer, but most are completely mistaken. And I don't say this to spark controversy, but to start an honest conversation. I am Dr. Jocelyn, a urologist at the Rochester Clinic in Minnesota, with over 30 years of helping couples regain connection and trust in intimacy. Throughout my career, I have heard thousands of versions of the same story. Men who try hard, who love sincerely, but end up wondering why she seems distant or distracted just when they should be closest. And almost always, the answer lies not in passion, but in physiology, in how the female body responds, in what she needs to feel comfortable, secure, and above all, fully alive. In this video, we will not talk about tricks or cinematic fantasies. Let's talk about human science, practical anatomy, and respect. I will explain the 5 positions that women really appreciate, not for fashion, but because they adapt better to their bodies. I will also cover 2 very popular positions that in practice often cause discomfort, but mainly you will learn why they work, how to adjust angles, rhythm, and contact so that the experience is natural and mutually satisfying. If you stay until the end, you will understand a simple principle that transforms the entire relationship. True intimacy is not about doing more, but feeling better, reading the signals of the body and responding to them intelligently. Let's get started. Before diving into the positions, there is a simple truth that will change the way you understand intimacy. And if you do not understand it, everything else loses meaning. Most men, even the most attentive, think that female pleasure depends on the same things that give them pleasure: rhythm, depth, and strength. But a woman's body doesn't work that way. Her pleasure is based on 2 pillars that must always be present at the same time: a constant and comfortable blood flow to the pelvic tissue, and reliable external stimulation right at the front of the pelvis while internal movement occurs. This combination of flow and contact is what allows the brain to receive the correct signal. Without it, even if there is affection or desire, the sensation disperses, dilutes. For years, studies reviewed by experts in sexual medicine have confirmed something surprising. Only a minority of women reach climax solely through internal movement. Most need or prefer simultaneous external stimulation, as that is where the largest number of nerve endings are concentrated. Therefore, when a man relies only on depth or speed without maintaining frontal contact, he may feel confused. He thinks he is not doing enough, when in fact, he is doing too much incorrectly. I have seen couples married for 20, 30, and even 40 years rediscover their connection with just a small adjustment, reducing the amplitude of movement and maintaining constant forward pressure, nothing more. The female body responds to the rhythm of stability, not haste. And here comes another point that many forget: the relaxation of the nervous system. When a woman is tense, anxious, or forced to adapt to an uncomfortable angle, her brain interprets the sensation as something it must control, not enjoy. But when she feels safe and the body receives gentle contact, the parasympathetic system activates, circulation improves, and the sensation flows naturally. Therefore, the favorite positions are not the most eye-catching, but those that allow for easy contact in front, gentle angles, and freedom to move effortlessly. This will be our roadmap for the rest of the video. We will not be looking for perfect positions, but intelligent adaptations that respect physiology and take care of the comfort of both. From now on, each position we see will include 3 things. 1, what makes it special from a clinical standpoint. 2, how to adjust it for greater comfort. 3, what signs to observe to know if it is really working. Let's start with number 5. Number 5, side lying, the silent spooning. This position seems simple, almost too everyday to lead a list. But in clinical practice, it is one of the most effective and appreciated by couples seeking comfort, connection, and duration. Being on the side reduces muscle effort, protects the joints, especially in people over 60, and allows for constant closeness without losing eye contact or physical affection. From a medical standpoint, this position keeps the pelvis parallel, which creates a smooth and gliding internal angle. This anatomical detail is crucial as it avoids deep thrusts that can cause discomfort and facilitates pressure control. Additionally, it allows one hand to remain free in the front, helping to maintain the previously mentioned external stimulation. Clinical advice from Dr. Jocelyn: place a small pillow or a folded towel between the knees. This aligns the hips and prevents pelvic rotation that can generate lower back tension. Keep the movement short and rhythmic, almost like a swing. The key is not in strength, but in the fact that the base of your pelvis remains in contact with the front of your body. When that contact is maintained, the sensation multiplies and the female body responds without the need for speed. In practice, many couples find that this position becomes even more pleasurable if they alternate between short movements and a gentle back and forth of the hips. There is no rush. The secret is to stay there, breathing together instead of seeking depth. Number 4, sitting on the edge or in the lap face to face. This position is as intimate as it is practical. One person sits on a firm surface, like the edge of the bed or a stable chair, while the other settles onto their lap facing them. Physiological benefits. Direct eye contact stimulates the release of oxytocin, the hormone of bonding and trust. Chest to chest helps synchronize breathing and reduces muscle tension, promoting stable blood flow. In this angle, the pelvis of the person sitting remains fixed, while the partner sitting on top can control the rhythm and depth. This stability transforms friction into a rocking motion, maintaining constant pressure on the front of the pelvis, exactly where most women feel the most pleasure. Clinical advice. Think about rotating and pressing, not pushing and pulling. Keep the base of the pelvis in full contact. If you want to vary the intensity, just slightly tilt your torso back or forward to change the angle without losing alignment. Both hands are free. One can maintain balance and the other can provide external stimulation. Additionally, this position is excellent for elderly people or those with limited mobility. It does not require strength or flexibility and can be maintained for longer without fatigue. Number 3, face-to-face, lying down, the classic rediscovery. Some call it more traditional, but when performed with attention and knowledge, it becomes one of the deepest in emotional and physical connection. The body-to-body breathing in the same rhythm allows for reading the micro-expressions of the face, something that in sexual medicine is considered a factor of neural synchronization. When a couple can read the signs of pleasure or discomfort, the nervous system adapts and the body responds better. From a clinical standpoint, the face-to-face position maintains a neutral angle of penetration that can be optimized by placing a small pillow under the receiving partner. This tilts the pelvis, aligning the internal surface with the area of greatest sensitivity at the front. Clinical advice from Dr. Jocelyn: shorten the range of motion and apply a light forward pressure at the end of each thrust. This constant pressure prevents the sensation from being interrupted, and the continuous frontal contact maintains the simultaneous stimulation that most women need. If you want more intensity without increasing depth, do not use more force. Change the angle with a folded towel. Small adjustments, big results. This position also favors nonverbal communication, touch, kisses, and eye contact. All of this activates brain regions associated with pleasure and calm. A relaxed body feels more. Number 2, woman on top, control and confidence. This is the conscious control position and is probably the most underestimated by older men. Here she sets the angle, the rhythm, and the depth. She can adapt to each moment, adjust her position, and direct the sensation to where she feels best. This not only increases her pleasure, but also reduces the risk of discomfort or pain, something essential in mature age. In large clinical surveys, most women describe how they deliberately change the angle of their hips to keep the sensation exactly on the front part of the skin. This position allows for that naturally, effortlessly, and freely. Clinical advice: forget about fast vertical movements. Think of circular or gentle rocking movements, keeping the base of the pelvis against that of the partner. This way, external contact remains constant and blood flow is not interrupted. If the knees get tired, there are safe variations. You can rest your hands on your partner's chest or advance a knee to reduce muscle effort. You can also partially lean on a pillow behind you. This position also brings a powerful emotional benefit. The feeling of autonomy and control increases confidence and connection because it eliminates the fear of discomfort. And when the body feels free, pleasure flows naturally. Number 1, from behind, precision and alignment. This position, often misunderstood, generates divided opinions in surveys. Some women find it too intense, while others describe it as one of the most pleasurable. The difference lies in the adjustments of angle, rhythm, and contact. When done without attention, it can feel too deep or impersonal, but when performed with the correct alignment, it becomes one of the most fulfilling. Clinical principle. The secret is in the tilt. If the receiving person brings their knees together a bit and tilts their hips slightly forward, the internal angle changes. Instead of direct pressure to the back, the friction falls on the inner front surface, where the tissue is more sensitive. Acronym. Clinical advice from Dr. Jocelyn. Place a pillow under the hips to adjust the angle precisely. Use slow, gliding movements. Do not push hard. Keep one hand steady in front to ensure constant external contact, and above all, communicate. Ask, look, feel. Trust does not interrupt the moment, it deepens it. In recent studies, couples who apply these adjustments report a significant increase in pleasure and emotional connection, especially when the movement remains smooth with pauses and shared breathing. Clinical summary by Dr. Jocelyn. All these positions have something in common. They do not seek performance, but alignment. They do not focus on strength, but on preserving front contact and maintaining a steady blood flow. This is what science confirms and what thousands of couples discover when they stop trying to impress and start listening to the body. So far, we have seen the 5 positions that tend to favor comfort, flow, and emotional connection. But in my consultation at the Mayo Clinic, when I talk to older couples, the same question always comes up. Doctor, what about the positions we see in movies? Are they really as good as they seem? The answer is clear, not always. Some look spectacular, but physiologically, they are not very sustainable or even counterproductive. Let's look at the 2 most common ones. 1. The standing shower position. In theory, it seems romantic, spontaneous, passionate. In practice, it is a physical challenge that the female body rarely enjoys. Medical reasons. The slippery floor reduces movement control, muscles tense up to avoid falls, and the water eliminates natural lubrication. This makes the tissue more sensitive and can even cause minor irritations. Furthermore, the internal angle is almost always too vertical, which creates unnatural pressure on the cervix. The result is discomfort, tension, and a total loss of frontal stimulation. How to transform it. If the idea of the aquatic environment seems appealing to you, simply move away from the direct flow of water. Use a stable surface, like the edge of the bathtub or a firm bench, where both can support themselves. This restores balance and allows for maintaining eye contact and frontal connection without forcing positions. The moment retains the same intimate atmosphere, but now it is safe, comfortable, and real. 2. The acrobatic position with the knees close to the ears. Very popular on the internet, but almost always problematic in real life, especially for women over 45. Medical reasons. This position requires extreme flexibility in the hips and lower back, causes tension in the pelvic ligaments, and can compress nerves in the lower back. The angle of entry, moreover, is often too direct, causing pressure in sensitive areas. What appears on the screen as depth is often felt in the body as pain or excessive exposure. How to transform it. To achieve a similar feeling of openness and closeness without causing tension, place a firm pillow under the coccyx. This reduces the bending of the legs and softens the inner angle. The movement should be short, slow, and accompanied by breathing. Adding a hand in the front or a gentle touch on the abdomen helps maintain the sensation where pleasure is truly felt. Both positions show the same pattern of error, prioritizing form over sensation, which is the opposite of what conscious intimacy seeks. Couples who enjoy the most, especially after 50 or 60 years, are those who read the signals, adapt, and replace attention with synchronization. Passion is not measured by acrobatics, but by the connection you achieve without saying a word. At this point, many men ask me the same thing in the Mayo Clinic consultation with Dr. Jocelyn. So it all comes down to a single area in front of the pelvis. Not exactly, but understanding this principle changes the entire experience. Most studies on sexual medicine conducted in the last 20 years, including research from Indiana University and the Kinsey Institute, agree on the following. A small group of women can reach climax solely through internal movement, but most need or prefer simultaneous external stimulation, not only for intensity, but because this combination makes the body respond in a more balanced and pleasurable way. From this, a simple and elegant rule emerges. Choose and adjust positions that maintain constant frontal contact, and then think about depth, speed, or rhythm, not the other way around. If you prioritize depth before achieving stable contact, pleasure disperses. The brain stops registering sensations as pleasurable and interprets them as repetition. Therefore, what seems like intensity often turns into disconnection. 3 practical ways to maintain a constant sensation. Breathing together in the first 30 seconds. It seems like a minor thing, but it's not. Synced breathing activates the parasympathetic nervous system, responsible for calmness and emotional connection. When both breathe in the same rhythm, the pelvic muscles relax and circulation increases. A calm body feels more and reacts better. DOs. Reduce the range of motion. In population studies, most women describing pleasurable experiences talk about short movements of constant pressure forward. The female body doesn't need large in and out movements. It needs continuity. Think about balancing, not pushing. When maintaining frontal contact, blood flow is sustained and the sensation never stops. TRS. Use smart support. Pillows are not a concession. They are clinical tools. A folded towel underneath can completely change the internal angle, enhancing the contact surface. This way, you avoid using more force and achieve more comfort and control. In older couples, this simple adjustment can make the difference between effort and harmony. The role of rhythm and body awareness. The ideal rhythm is neither fast nor slow. It is one that maintains constant pressure at the front. During the first few minutes, a stable, almost meditative time allows the female body to recognize sensations and fix them in the nervous system. Only when she begins to respond clearly through breathing, movements, or sound is it possible to gradually increase depth or speed. Doing this earlier is like building on sand. The body has not yet found its foundation and something fundamental, mental presence. The most powerful contact is not always in the hands or the body, but in attention. Listening, observing, noticing how the rhythm of your breathing or the tone of voice changes is the most precise way to guide the moment without guessing. The body speaks. Science merely translates its language, micro-adjustments, inclination, and balance. Modern medical research describes 2 movements that, although minimal, transform the experience: inclination and balance. Most women use them unconsciously. The tilt alters the angle of internal contact, while the sway maintains constant friction at the front. These are small, slow movements, coordinated with breathing. When the partner follows along, no more is needed. The body finds its own rhythm. Keeping a hand or a point of contact at the front of the pelvis, whether with hands on the abdomen or with a soft accessory, is the difference between almost there and there. It's not an opinion, it's evidence. Studies show that women who receive constant external stimulation during intercourse report significantly higher rates of climax than those who do not. And all of this requires no technique, just conscious intention and gentleness. The true art of mature intimacy lies in understanding that the small details, the breath, the pressure, the rhythm, the angle, do not diminish spontaneity. They create it. Research on favorite positions is useful, but it hides a detail that science confirms every day. In clinical practice, there is no single ideal position. What women and mature couples generally enjoy most is not a form, but a condition: the possibility of adjusting the angle and maintaining effortless front contact. This means that positions are merely structures that you adapt. True pleasure arises from the personalized adjustment that each couple creates within them. When I observe couples over 60 who have regained their connection, I notice a clear pattern. They do not focus on technique, but on listening. They have learned to read the small gestures, a breath that quickens, a slight hip movement, an almost imperceptible sound, and to respond attentively without breaking the rhythm. This ability to read another person's body is a form of emotional wisdom. It is not taught in any book, but can be learned through presence. 3 signs that guide better than any manual. Breathing. When she starts to breathe more deeply or sighs rhythmically, the body is aligned with the feeling. If she holds her breath or does this, it's a sign of tension. Slow down, change the angle, or get closer to regain contact. 2. Stillness. Often the most intense moment is not one of movement, but of pause. When both remain still for a few seconds, the brain interprets this stillness as safety. Tension decreases and the feeling expands. Learn to sustain these silences. They are not empty, they are fullness. 3. Muscle tone. A relaxed body feels warm and receptive. A tense or rigid body is protecting itself. If you notice resistance, don't insist. Adjust the position. Support with a hand. Speak calmly. Tenderness does not interrupt passion, it deepens it. Communicate with elegance. Speaking during the encounter is not a weakness, it is a sign of maturity. A simple phrase like, "This is good," or "Do you want me to stay like this?" can open a huge door to trust. Gentle communication reduces anxiety and activates the brain's reward system, generating an immediate sense of closeness. Dr. Jocelyn summarizes this in her workshops at the Mayo Clinic. The body has its own language, but the voice can be its most accurate translator. In other words, asking does not erase the moment, it illuminates it. Mature intimacy is not about discovering new positions every night, but about rediscovering the same person with more understanding. Sometimes, a small change is all it takes: a higher hip, a shorter movement, a firmer hand for the body to feel at home again. If you seek closeness and communication, start face-to-face. Keep movements short, smooth, synchronized with breathing. Support one hand on the front of the pelvis and press your body forward, not backward. The goal is not depth, but the continuity of contact. The more constant the pressure, the easier it will be for both to relax and get in sync. If she wants more control over the rhythm, invite her to be on top, facing you. Let her determine the angle, speed, and movement. Don't worry about leading the relationship. The female body knows how to find its point when given freedom and support. Your firm and calm presence is more powerful than any quick movement. If both are seeking a deeper internal sensation, try the back-to-front position, but with care. Before starting, place a pillow underneath to adjust the angle and reduce depth. Keep one hand or gentle pressure on the front of her. The combination of internal and external contact is what transforms an intense position into a pleasurable and safe experience. And if you want to end with calm and tenderness, switch to the side position, the spooning. Breathe together without haste. At this moment, words are unnecessary. The warmth of the body, the rhythm of the chest, and the shared breath become the most human language that exists, the thread that connects everything. It is not a technique or a hidden secret in a book. It is a simple and universal principle. Stable comfort at the front of the pelvis, adjustable inner angle, and movement that maintains sensation. This is what research shows. This is what bodies confirm when they learn to listen to themselves. And this is what transforms any moment into a truly intimate memory. In sexual medicine, we often say that pleasure is a form of advanced communication. It is not about winning, but about understanding, letting the body speak and responding attentively. Mature love does not seek to impress, it seeks to understand. After 60, the body changes, but sensitivity does not disappear. It simply needs new conditions to express itself. Every muscle, every breath, and every pause can become a bridge between two people who choose each other with respect. I am Dr. Jocelyn, urologist at Mayo Clinic in Rochester, Minnesota. And my wish is that this knowledge is useful, not only to improve your intimacy, but to live it with more serenity, empathy, and awareness by your side. If this video helped you see things more clearly, share it with someone who also wants to learn to nurture the connection with kindness and curiosity. Because true intimate health does not start in the body, but in the way we choose to look at, touch, and listen to each other. And remember, age does not erase desire. It only invites us to live it with more wisdom. M.